And so I'd like to welcome everybody for today's conversation, which is focusing on pivoting your venture to meet pandemic needs. Really excited to be joined by three fantastic YouthActionNet alumni who are going to share some of the ways in which they are adapting the work of their social venture to meet our kind of current reality and current needs related to the coronavirus pandemic. And we're really excited to be able to bring this session to everybody with the support of the Koch Foundation. And so I'm going to open up the videos so that we can see each other nicely and start by asking each of our three panelists to just briefly introduce yourself, if you can share your name, location, and a very brief description of your venture's mission or key area of work. Let's start with Sarah.
Hi, my name is Sarah Koch. I am the founder and executive director of Development and Gardening, or better known as DIG. I was a Youth Action Fellow in 2008, so it's been some time, and still trucking along with this organization. So DIG is rooted in the belief that food is a leverage point that can change the world, and arguably the most important leverage point. And what DIG does around food is use restorative agriculture as a way of addressing nutrition and food security for uniquely vulnerable communities in Africa.
Awesome, thank you. Wonderful. Let's hear from Vinayak.
Hi everyone, my name is Vinayak Acharya. I am the founder and CEO of ThinkZone. We are based out of Odisha, India. I'm a Youth ActionNet Fellow 2017. So what we do at ThinkZone is we work towards improving the educational outcomes of children from under-resourced communities using a tech plus touch model and activity-based methodology. We enable community educators, public childcare workers, public school teachers to deliver quality early grade education programs by using ThinkZone's technology, our teaching resources, and the entire pedagogy. So till date, we have already provided quality education to more than 5,000 plus children across remote villages of India. These children have developed or improved their learning levels, one to two learning levels in a matter of 1 year. Apart from that, we also work with the educators to improving their skill sets so that they become better educational facilitators.
Great, thanks, Vinayak. And finally, Daniela.
Hi, I'm Daniela Rodamales. I'm from Chile, and I'm a fellow, YouthActionNet Fellow from 2018. And my organization is 3D Prosthetic Foundation. We normally empower people with disabilities through the giving of 3D prosthetic hands. We make it with 3D printers. So now we hold that because we can't buy the COVID, and we're just reinventing ourselves.
Okay, thank you. We're going to come back to all of these things. So I want to come back to Sarah. And Development and Gardening, or DIG, was already focusing on increasing food security and resilience for vulnerable populations in Africa. You mentioned that you really believe in food as a key leverage point. So I'm curious to hear a little bit more about, you're working in the same field as you've always been working, but how are you doing things differently now because of the coronavirus pandemic?
Yeah, so DIG's work has always been sort of rooted in community in addition to food. We work with, when I say uniquely vulnerable people, they're groups of people who share some vulnerability. That could be HIV, they're living with HIV. It could be that they have children who have been diagnosed as malnourished, people who are living with physical disabilities. And that shared vulnerability is an opportunity for us to kind of gather together in community where some individuals don't really have a community to gather with. So it's forming community. So a big challenge that we faced immediately was social distancing and realizing that we couldn't build community in physical presence with each other. So knowing that needed to be a big part of our work anytime, it became the challenge of figuring out how do you do that remotely when communities don't have technology like a computer to do Zoom calls. So what some pivots that we've done have been to start SMS messaging all of our farmers in a feedback loop, so that we send them 3 messages every week, and that can be something about what's happening around COVID in their country or their particular community. So it's global recognized expert information, but also nationalized for that particular location. And then also really focusing on agriculture. How can they be growing in this time? What are they going to need to think about going forward? How, you know, what crops are going to be missing from the marketplace in the weeks and months ahead, so that they are getting what they need, and then getting them to message back to us how they're doing, what their challenges are, how can we help them. It's been one way we've pivoted, but that intimacy and communicating out and getting the message back has been a really powerful way to keep building that community, keeping them connected to our local facilitators so that they have an opportunity to just share what's going on and know that DIG is still there to answer questions and support them on their journey with agriculture.
Great, thank you. Danny, I know that Fundación Protesis 3D has been using a unique model for creating both that employability skill set for young people who are in detention, as well as then getting very needed prosthetics to children who are living with disabilities. But you mentioned that you're having to reinvent yourself now and using 3D printers in a different way. So can you talk a little bit about what is the new version of your work, and how are you changing your operations?
Yeah, well, we last year was very complicated for us. So in March we were like stop everything because we ran out of money, we ran out of team, we ran out of everything. So then the COVID started, and we figured out that all the, like in the whole world, all the hospitals wasn't having protection for their professionals. So we just decided that there were some people doing these face shields that it's really simple, and it's reduce the possibility of get the virus, you know, to all the professionals. So it's very simple. It's easy to, it's washable and reuse. So it's a simple, easy way to help to all the public health centers. Now we're running a campaign that we are going to give 5,000 to all my region. So we are using the 3D printers just to print this part, and it's very easy, you know. We are changing everything. We stopped doing prosthetic hands because we have to meet the people to give them the prosthetic hands. So we don't have buses, we don't have flights, we don't have nothing. And you know that still is a very long country, so communications and transportation is very important. So, and if we can do, like, for example, a prosthetic now and give it away, I don't know, 5 months later, because the children grow out, the people get fat or get skinnier, so it's not available. No, it's not useful, you know. Mm-hmm. So yeah, we changed everything, and we are doing this face shield, and we're helping, and we are trying to, the professional health are the 12% of the people that get the COVID. So I think that it's important to protect them.
Great, thank you. Vinayak, so I know that ThinkZone, as you described, is already innovating in terms of making education more accessible to low-income communities in India, and you had your unique school in a box model, but what new products or services are you doing now to fit kind of the current constraints because of the pandemic?
Yes. So at ThinkZone, as I mentioned before, we directly work with educators who are, you know, community teachers or public school teachers or government childcare workers. So as COVID-19 hit India, all these childcare centers or government schools went into lockdown. So what happened was that children in these under-resourced communities were not getting access to quality education. What we also saw as a response to COVID-19 was most of the education support interventions during this crisis were online, app-based, and was unfortunately out of reach for the majority of the population. Because in India till date, I think 20 to 25% penetration rate is there of smartphones, and it is in fact much lesser if we go to the hinterlands. So as a direct response to the crisis, what like we at ThinkZone did was how do we use accessible technology to implement home-based education program. So so at ThinkZone, what we decided was that how do we directly reach to children who were not coming to educational institutions. So what we did was we tried to reach to the parents of these children through a voice call and an SMS-based learning platform. So that the parents can engage their children in activity-based content. So the access of the content is absolutely free of cost. What the parents need to do is either they can call to a number or they have the facility to receive learning modules every day on their feature phone. So what like the basic objective of this home-based education program was to develop positive parent-child relationships as well as enabling parents to work towards developing learning skills of kids from an early age. So we already had a parental engagement program before COVID-19, but we had actually not really implemented that on ground. Just when COVID-19 hit India, we realized that like because ThinkZone programs were not getting implemented in our partner schools and childcare centers, then why don't we try to work on this existing product of ours, make it more personalized and directly reach out to parents and children. So that is how we, I won't say we pivoted, but then yes, focused our core, all our energy to this home-based education program so that we could reach out to maximum number of children during the ongoing crisis.
Great, thank you for sharing that. So I want to come back to the subject of technology because all of you are using kind of different aspects of technology in different ways. And so I'd love to hear from each of you about a little bit more about kind of the specific choices you made of what platforms you're using or how you're using the technology and why that's working for your venture and for the populations that you're serving.
I can start with the lowest level technology because Dig, it's got to be low level technology. Most of our farmers don't have access to smartphones, but they do have access to just simple textable phones. So SMS was as fancy as we could get. And not even all of our farmers have that. So for the farmers who don't have access to a phone, our facilitators are able to go and make personal house visits and from a distance check in with them. It doesn't happen quite as frequently as 3 times a week, but we are trying to meet even those needs. But we're using a platform right now called Telerivet, which allows us to mass send messages out and also receive and process messages back. And they've been very generous to give us a good discount to do that. And that's been able to help us reach farmers in 3 different countries. Right now we have 1,000 farmers that we're messaging 3 times a week on that. And then we have other things that we're doing that have nothing to do with technology. But that's really just because our farmers have such limited capacity.
Mm-hmm. And Sarah, you had mentioned the kind of frequency, the 3 times a week with the messages. Is this kind of in line with how you were usually communicating, or like frequency with which you were usually communicating with your kind of target populations?
Our programs, we meet with them in person once a week. And so this is a little bit more frequent in just communication, but obviously much less communication. And then our facilitators are able, so a lot of the messages that go out are mostly directed by our country directors and approved with, thought through with us, but really they're the ones crafting those messages because they are the ones most aware of what's appropriate for their communities. But then the talk back and the personal check-ins happens with our local facilitators. So there is lots of opportunity to coach people with planting. We've had a couple of our facilitators go out to homes pretty regularly and just check in on their farms. They can do that safely, see what's going well there and what's not, and making sure that they're correcting and helping the farmers adjust and make sure that they're getting what they need to keep planting. Where we're limited is onboarding new groups. So our groups usually go through a graduation process, and it takes about up to 6 months to work through a community or through a group. And what we're doing is messaging with all of our current groups and then past farmers to make sure that even ones we've graduated are still in touch with us and we can support them. But onboarding, if this lingers for a lot longer, how we onboard new groups will be a whole different ideation process.
Yeah, that's certainly building new relationships during this time, especially with that kind of typical reliance on the face-to-face part of relationship building will be a new challenge.
Yeah, and it's very hard for the social distancing, and where we work in Africa, people are just such physical people. They encounter, they are with each other in so many spaces. And so trying to even get our facilitators to understand the importance of social distancing and not put them in a trajectory that they're going to be visiting households and not respecting that social distance measure has been a learning curve for us as well. We've had a safe seed packaging program where we noticed that seed prices were going way up in a lot of the countries and communities where we were working, and we needed to make sure our farmers were able to access seeds, and most of them would not be able to buy seeds at those prices. So DIG purchased them in bulk, broke them down into smaller quantities and distributed them out, and that was getting our facilitators, most of who have graduated through our programs, and so our farmers themselves, getting them to understand that, okay, we're distributing seeds, but it needs to be done in a very rigorous, safe way, and making sure that they're understanding that message and what's required of them before they potentially go out and interact with the community.
Mm-hmm. Some interesting challenges and something we could come back to as well about what's happening in terms of understanding about these measures that people should be adopting, and the kind of social distancing and those other elements as well. So Danny, I wanted to ask you a little bit more about the 3D printing side of things, and kind of where have you gotten the information that you needed in order to pivot to printing something completely different, and how are you handling both the production and the distribution of what you're making?
Okay, well, the amazing thing of the 3D printing world is that there's a lot of open source things. So when this COVID started, everyone started uploading and different designs. So we are connected with organizations in United States, in Europe, that are makers. So I started receiving a lot of information about the COVID and what different countries were doing. So we start testing different models, different things. We have a doctor who worked with us. So it was like, okay, we have this one, try it, and try this one. So because ones look very nice, but in the practice were a very bad model. So that's why we ended up with this model that is very, very simple, useful, and washable. So that is the three most important things. And well, we knew about 3D printers. It's not different to print a prosthetic hand than a face shield. So, and now we have another challenge, that it's like 3D printers are not a good manufacturer way to do a massive thing, because are so slow. They have good components. For example, we use a filament that is it's made with vegetables, so it doesn't get allergies in the skin or it's not toxic, so it's very good for health programs or health professionals, but it's very slow. We have 6 printers, and each one can make 40 face shields per day. So it's really, really slow. So now we are trying to figure out new ways. We are working with milling machines, and we are, of course, we don't want to reduce the quality. So we are using, for example, PVC. I don't know if it's called like that. That it's a material, that it's a plastic that have antivirus components. So it's very safe too. And with that, we can do maybe 2,000 or 3,000 per week. So the production increased to, so much more. So we can help more hospitals and more organizations or ONGs that are working with them with all this COVID thing, and no one is paying attention to them. So that's how we move to prosthetic hands to face shields.
So it sounds like the importance of prototyping and testing is still really central to making this work, and some interesting challenges that people might not be thinking about in terms of you can't just pivot over to printing something new with 3D printing and expect it to go from 0 to thousands right away. Yeah, that's really great insight. Thank you, Danny. Vinayak, so you already had kind of the school in a box that you were doing for home-based learning, but I know that you've kind of changed a little bit of your focus and where you're putting your energy, and I think that you are also doing some radio-based learning. So could you talk a little bit more about the technologies, any kind of specific platforms, or what technology you need to work around in order to make your school in a box accessible for home-based learning?
Yes. So what initially we had the platform was for educators who were using on their smartphones. Right now the change that we had was not everyone, as I had mentioned before, had smartphones, and this we were talking about were children from under-resourced communities. So most of these families, as Sarah had mentioned, have feature phones. So what we did or what we started just after COVID-19 hit India was we started with our voice-based education programs. Now what happens in such a scenario is that the parents have the facility to either call to a number and listen to daily learning content, which are activity based and simple to do, which does not require any resources to implement at their home, and these activities could then be done by the parents with their children. In the second scenario, the parents also have the option to, if they're not calling every day, they can actually get push you can say learning content every day, say in the evening or in a stipulated time. So in that scenario also they get learning content. The whole idea is to how to engage parents in developing the learning skills of children. So in the earlier scenario, what our core focus at ThinkZone was that how do we enable or develop the skills of educators, facilitators, so that they can directly work with children. Right now what we are doing is that trying to build the skills of the parents so that they can work with the children to improve the learning outcomes. So the core mission or the vision of ThinkZone you can say has not yet changed. We are still trying to reach out to children with quality education. Before COVID, what we were doing is we were directly reaching out to children via you can say educators. Right now after COVID, we are reaching out to children but with their parents. So we are using feature phone technology. Yes, what you mentioned about radio was that this is a very simple solution which has a massive scale. So we partnered with a local FM channel who are playing the same content that we broadcast via IVR every day for 30 minutes. So what right now is that even if not all parents know that we have an IVR solution, or they don't have the facility to call, but they are at least listening to radio for say 30 to 30 minutes. So in that scenario, what is happening is that they are switching on the FM channel and they are listening to the content and then implementing the same at their home. So it's a mixture of radio-based learning and feature phone technology using SMS and a voice-based platform is what we are currently doing. So this, after like as a strategy, what we are thinking is that this could be actually scaled, even like say everything opens and the pandemic gets over and everyone is there, everyone is moving around. But still then this is such a beautiful and a simple way to reach out to parents. With a simple technology, that is what we want definitely to scale it. Apart from the original program where we are first training the facilitators to implement our school in a box solution.
Wonderful, thank you. And I love that you're also thinking about what might be useful and usable, after we get through the worst of this pandemic in terms of a longer term solution. And that's great, and kind of a return to older technology, but something that we're finding very useful now. So I have one more question I'm going to ask any of you to kind of respond to, but before I ask that question, I want to mention that if any of our listeners have a question that they would like to pose, you are more than welcome to post it in the chat. Or after we do this question for me, then you're also welcome to unmute yourself and ask out loud if you would like to. So the question is kind of another general one, and so you all have already at least hinted at some of these things, but I think it would be really helpful to get a sense from each of you about maybe what's one surprise or kind of maybe a surprising challenge or roadblock that you've had to navigate as you've been thinking about either pivoting to new methods of communication, pivoting to producing a new product, or kind of returning to a previous product but focusing on it in a new way. So a kind of a challenge or maybe something you weren't really expecting to have to navigate that you've been working through with your venture.
I can start. Since that's our cadence here. A couple things. For instance, in Ziguinchor, Senegal, where we're working, all the markets have been closed and the roads are also closed. And so what we have found is that our hospital gardens are literally the only place for people to find fresh produce. And that has created two things. One is this really beautiful opportunity for our farmers who have been marginalized in many, many ways. And many, because it's a peri-urban area, many have never really even seen themselves as farmers. They don't have land that you would typically think would be used for growing. But they are now starting to see themselves as the producers for their community, and the value that they have in realizing that is so exciting. Because DIG has been working in many ways outside of global food economies, we're working with farmers who haven't had access to markets or value chains. They are oddly very well equipped to weather this storm. That DIG has always been about creating resilience in these spaces where they don't already have access. And creating access where there hasn't been. So that's been kind of an exciting opportunity for us to start thinking about and leaning into. And not only, these are things that we've articulated in other times in other ways, but the real awareness of that strength and the value of that is going to be seen by others. At the same time, these clinic gardens in Ziguinchor are now, because they are the only place to find fresh produce in the region or in the area, they're being looted. So we're having to figure out, well, how do we now do we have a security guard there at night? This has never been an issue before, but that's a new challenge that we have to figure out. How do you create a space that produces for the community and open it up for others, even outside of our own farmers, but also protect it in a way that we've never had to think about before.
So both a new kind of positive outcome, that a shift in that mindset and approach, but now this new challenge about actually like the literal security of the food.
Yeah. Yeah.
Interesting situation to navigate, especially from afar.
Yeah.
Others, Danny or Vinayak, a surprising challenge you've had to encounter and navigate.
We have two surprising things. One is that we always been struggling with money and donations, and we ran out of money before this, and we think, okay, we can do face shields, and we start running a donation campaign, and we get more money than we get in the whole last year. So was very successful. And then we say like, okay, we can do, you know, we sell one and we give one, so it's running very well too. Then we receive a donation to give 5,000 face shields in the region to the hospitals, public hospitals. So that was a big surprise, that because we're not struggling with money, we have money, and we have the ability to save now to the prosthetic hands in the future. So that's crazy. And we've been struggling with the supplies. We have a stock break. I don't know if it's called like that. There is no supplies in Chile. We bought a lot. We get this 5,000 donation, and we bought all the materials, but there's no more in Chile. So we'll have to figure out how to import to China, or I don't know, China it's complicated, so maybe United States or whatever. We never deal with that before, so it's kind of crazy, because we can do it by ship because it's too long, and for airplane you just can bring some, not too much. So, and if it's medical supplies, they can stop it in the entrance of their country, because it's for other, I don't know, assignment for other things. So it's kind of very complicated. We're trying to manage that. So if you can help me later, it's okay. So yeah, it's been crazy, because I'm all the day trying to figure out where I can find something. I already searched all my country and find some supplies in the very south, but it's like, and everyone is fighting for them, because these face shields are getting very popular, not for hospitals or health centers, for just people. So there's a lot of people selling this in a very good price. It's not a fair price. So they are taking everything, and it's like, okay, we want to save it from hospital. That it's a very important thing. So it's like a kind of a fight for supplies that is very crazy.
Wow, yeah, those are a couple of surprises. So a very good surprise that you actually have the funds to keep operating, but with the major disruption in supply chains, that's a whole new challenge to try to figure out how you can source your materials. And sounds like you've been doing a lot of work to try to collect those materials, but you're going to be running out very soon. Vinayak, any surprising challenges you've encountered with your current work?
Yes, so the first challenge or you can say the surprising factor over here is that education per se has never been given the importance during any crisis. So what happens in such a scenario is that like, I understand healthcare, food and everything is the first thing, but children's education is never, you can say, highlighted during such a thing. So this has actually affected in our outreach activities or plans, because we intended to reach out to 3 to 4 times more children by this time, which unfortunately has not happened. till now. So that is one challenge where we are like, where as an organization we are facing is we are not being able to reach out to more number of children which we intended to. The second challenge I feel obviously is the evaluation or the monitoring of the entire program that we are doing. So our initial program, we had a very, a string, or you can say a very a good framework wherein we were able to monitor, we were able to support the education programs. But in this lockdown stage, because this is a new program that we have launched, we are being able to do, we are able to reach out and impact a lot many students. But to have a proper thorough evaluation is what I feel is a challenge that we are facing because of the lockdown. So there are a couple of things, like a challenge obviously is because of the limited outreach, we expected a lot more. And second obviously is the is this challenge of evaluating it.
Some big challenges to be thinking through and tackling moving forward. So I got some great questions from Ashok, and I want to open it up as well. If anyone else has a question, you're welcome to submit. So one question, actually, Danny already spoke to the kind of financial situation of our venture, but I'm curious to hear if either Sarah or Vinayak are willing to share if like how are you doing kind of financially with your venture? How are you managing the financial resources differently than before?
I have a couple of things to say on that. First, DIG has this incredible capacity. I think it's sort of reminiscent of the power of seeds. Like, we can shrink down and get really small if we have to, and then come back. So we did that in Senegal. We started in Senegal 13 years ago, and then we left and went to East Africa, and we only came back this year. And when we came back, we found that all of the farmers that we had trained were still growing, and they became our local facilitators for moving forward. So that allows us, if worst case scenario, we can't continue in any of these countries where we're working, and I don't think we'll get to that point, but if we got to that point, we could disappear for a while and come back. The things that we are teaching are still, it's never been a program that was meant to be sustained by us. So the things that we've taught our farmers will continue to reside and support our farmers. It's just whether or not we get the opportunity to grow and reach more people. It's also really hard. I mean, we're in a position where DIG isn't living, or we're not operating month to month, which I'm very grateful for. So we have time, and we have time to be able to ensure our local staff are still going to be paid in full. And we just have to hope that the resources come. My expectation is that we might lose some individual donors who are hurting themselves, and I completely understand that, and we need to prepare for that. Trying to find additional fundraising through foundations. The challenge with foundations right now is that they're doubling down on the organizations they're funding, which I'm grateful that they are, and they should be, and we have foundations who are doing that. We also have had foundations who have told us that they can't, because their fundraising mechanisms are unsure, that they might not be able to grant what they thought. So we're seeing all the different scenarios. We're trying to look for unique opportunities, that is new funding for COVID responses. And we have several different things that we're doing, 4 different initiatives that we're doing that would qualify for sort of COVID response. So yeah, we're just kind of holding our breath, hoping that the individuals that have supported us in the past are committed to the work that we're doing and what we're about. And DIG has done a really beautiful job building community, not only in our farms abroad, but also in our donors here in the States. And I'm actually encouraged by many of them. So we're just taking steps. We're being mindful of not taking risks right now with our in what we might spend money on, and just trying to make sure our staff are well cared for, and our farmers are getting what they need, and just holding our breath.
Bit by bit. Vinayak, anything you want to add to this question?
Yes. So right now what we are doing is reworking on the entire financial budget of what our top priorities are right now. So if the mission of ThinkZone is to obviously reach out to children with quality education programs, a lot of the activities which involved, training or, program support and monitoring, those things have been budgeted for this home-based education program. So that is the first thing which we have done. When we realized that, hey, at ThinkZone, we want to provide quality education to children from under-resourced communities, and what are the different ways in which we can do that during this crisis. So if we think on that line, and then we are able to, budget that accordingly for the current program. So maybe for the time being, say from April to September, if we are not doing trainings, if we are not doing program support and a lot of other activities, what we have done is that try to put that budget to scale or implement the program, the home-based education program, as a direct response to COVID-19. So that is what we have done. We are the mission is the same, as I mentioned before. The mission and vision is the same, and how do you try to reach out to that goal is what we are doing it every day.
Great. Sounds like some difficult decisions. So we are coming to the kind of toward the end of our time together, and I want to be mindful of all your time, and there's a lot more things that we could talk about, and it's really great to hear from each of you about the work that you're doing. I would love it if any of you have a lesson to share about something you may have tried in the kind of the last couple of months that didn't work or failed, that was a good kind of like lesson that you might be able to share with others as they're thinking about how do they pivot, how do they keep operating.
I can share something. Hold on, let me activate my video.
Awesome.
Hi,
Thanks,
everyone. Now you can see me. First of all, I wanted to tell you, I kind of felt identified with what Sarah was talking about, because I also work with artisans that live kind of like in the rural parts or outskirts of the city, and they have limited access to technology, and they manufacture leather shoes. So that's what my venture does. We commercialize internationally the locally made shoes by these artisans. So what I have been thinking, I know that the manufacturing sector, for example, is going to be very affected during the upcoming economic crisis. And I found it really interesting what you were saying about the new ways of communication that you're thinking of to do with your farmers. So besides that, I wanted to ask you what are some steps that you're considering to shrink or reduce costs of your venture so that you don't have to disappear completely? Because I know that's something that I'll have to do. You know, I don't want to say, okay, we're going to disappear because nobody's going to buy shoes. We are not, you know, we won't be able to make them anymore for who knows when. But I'd like to maybe do something else to keep sustaining, or at least, you know, covering costs, which means basically paying something to them so we don't leave them without an income. So what are some things that you have considered to like reduce your size?
Yeah, well, it's this might be a better question for Daniela, since she's really maybe more in the product development. Dig's work has always been really inexpensive, intentionally designed to not be, you know, promoting anything that our farmers couldn't purchase or continue on their own. So our costs are usually our, you know, facilitators, seeds, some, you know, farming materials. It's minimal. And because we're not traveling out to our sites, we're not meeting with the farmers in person in the degree that we were before. We're redirecting that resource towards communication. And yeah, I feel like we don't have a factory. We don't have, you know, we don't have products that we're pushing out. that we have to figure out what to do with. So your challenge is a bit more unique, and that's a hard one to solve.
I think that this time it's for restructure all the entrepreneurships and redefine the problems. So and we have to look what it's missing, you know, the new needs, because there's a lot of new needs. For example, we at the first time we get so scared. We have the possibility of donations. We got the possibility of a campaign to 1+1, and we got the possibility of just selling. And we get so scared. We didn't bought enough supplies, and we were missing all these opportunities. But the big shot was to change what we were doing to do something else. For example, like an idea, you may choose. And that's your entrepreneurship. You do choose and sell shoes. So one problem that is in Chile that I think that in your country can be too, it's that the doctors need shoes for getting into the hospital. So it's not a fancy shoe, you know. You make great shoes, but it's a shoe. It's like some, I don't know, textile thing with I don't know, a band that you put it over. Maybe for this time you can do shoes for hospital and change everything. And maybe for your same clients, you can ask them donations. Now, I think that in this time, it's maybe a few years ago, you just have donation to nonprofit organizations, but now you can do donation to everyone. In Chile, there's a lot of companies like for profit that are asking for donation. So they say, for example, okay, we sell these face shields to, for example, I don't know, it's like $5, for example. And so, okay, you pay me, I give you a bill, and I give it away to the places that there's needed. So you do this transaction, but from another product that it's helping to this COVID. So maybe you can put all your workers to, okay, stop the shoes, like fancy shoes, because no one is going out, no one needs shoes.
Yeah, of course.
And maybe do this shoes for hospitals, and ask to your clients that you are doing this, so they can give you money, donations or something like that, and you can give to the hospital. And with that, you can apply to all the funds that are running right now, that there's a lot of funds for COVID, and there's a lot of funds for protection to hospitals. And maybe you can find these new needs and redefine your entrepreneurship. Maybe that's an option, because if we don't change now, like the title say, we keep voting, we're going to die. And it's like entrepreneurship. It's not there's no way that we keep going as the way that we used to. Or maybe Sarah, that have a very, very slow cost.
Thank you. That's a great idea. Thanks. Definitely worth considering.
Yeah, great insights. So for anyone, either if you would like to share either an example of something that you've tried so far that did not work in terms of your pivoting, or actually it could be either an example of something that didn't work, or just in general. I'd love to hear any last recommendations or words of wisdom for other social entrepreneurs during this time.
I really love Ashok's question here about what we can learn going forward. And something that I'm passionate about is making sure that we're creating these feedback loops and listening to the communities that we're trying to serve. And Elisa, this sort of goes to you, you've got this staff that you want to continue to employ, and these artisans who deserve to be employed. And what are their ideas? What are how much are we all listening to the communities that we're serving to create our own solutions. I was listening to a different webinar, and everything was like, go out and change what you're doing, and change what you're doing and just start rolling forward with something else. And DIG has been a really slow burning organization. We've been around for 13 years. I started it not having any clue what I was doing. I still feel like I don't know what I'm doing, but it's listening to the communities that you're serving and letting them direct what the answer is and what the next steps are. And there is a desire right now to step forward and act immediately, but I think there's a lot of red flags that we need to be careful of, and we need to make sure that the people who are directing our steps are the people that we're serving, and that's something that a lot of the world was never very good at to begin with, and this is a good opportunity for us to pause, listen really deeply with compassion and empathy, and then take steps forward with the communities that we're serving.
Yeah, thank you. That's definitely important. Not only telling them how to do things with this new reality or how to change, but also listening to what they can do or they want to do, right? Because in the end, as you said, they are the main beneficiaries of what we're doing.
Yeah, thank you. That's a really great point to underline. And conversations that we've been having recently with other YouthActionNet community members, they've talked about using this time to reconnect and strengthen their existing relationships, whether it's with funding partners or whether it's with the communities that they're serving, or both. And I think that really underscores the importance of listening and starting with a place of empathy as we figure out how to continue to navigate, whether it's pivoting or recreating ourselves. Danny or Vinayak, any kind of final words of wisdom for other social entrepreneurs?
I think that we need to try to look to the future. Like, okay, now we are like in home, but in, I don't know, maybe 1 or 2 months, we are going to reestablish all our daily days. So going to work, going to school, going to university. So we have to think about what it's going to be needed. And I think that it's a time that it's very easy to sell, for example, something that it's needed. But I think that as a social entrepreneur, we have to fight for the fair prices and trying to understand what we can do, where we can help, and fight for that, for fair prices, and not, people that it's using this for just get well.
Thank you. Good point too, with how important it is for us to continue to remember the social part of social entrepreneurship. Vinayak.
Yes, so whatever Danny said right now is completely correct. Like if we understand or if we align ourselves to the overall mission that we had, and then implement the work on ground. So even if it's this pandemic, or maybe like before and after thing, all the activities would be aligned if we completely think on those lines only. So yes, implementing in multiple forms for any social enterprises will be a challenge. But if we really think as a team that hey, this is our end goal. So I guess we obviously can find a solution for everything that every challenge that we face. So yeah. So my end thing is, like, if we are able to think that like we want to achieve our mission and these are the activities which we want to do. So I guess so it's possible.
Wonderful, thank you. So stay true to the mission. look for those new opportunities and be thinking about what's coming next, but keep remembering to listen first to the people that you are serving. Great final insights. I really want to thank all of you for joining us for this session. Sarah, Danny, Vinayak, and Elisa coming in at the end with some great questions as well, for sharing your time, your insights, your experience, your challenges, and particularly now, I know that you are all so busy doing really important work that I really appreciate you each taking your time to share with us and to take a little bit of time to talk about the important work that you're doing so that others can learn from that as well. So thank you again. And we're going to close that session, our conversation officially now.